Good morning, everybody. We are just a little after the hour and it's Friday. We made it to Friday. I'm super excited myself and lovely to see you all here. We will be starting with our first session shortly. But first, of course, I want to just welcome you all again. It's our third day of our virtual conference and more to come, of course, next week. We'll start again on Monday of next week. So please be sure to come back in on Monday to continue. But today we have two wonderful sessions. We'll be doing a session that focuses on understanding data and then how do we translate that into action, which is just so needed. And I think we all could really use a lot of help on. And then the second session that we'll be having is, I think, also very relevant to just probably what we've all been experiencing over the past several years. Just seems like an increasing number of scams or just misinformation that we're seeing and hearing about health coverage, among other things, and just how do we help ourselves with that, but also how do we help consumers both figure out what's something that they can trust, but also just how to help them if they've been caught up in it. So looking forward to those two sessions. Before we get started, just some general announcements and some things I wanted to be sure to walk everybody through, since I have this floor and I can use this to my advantage. So I'm going to try it again. I've really not had a whole lot of success with sharing my screen of late, but I'm just going to keep trying, right? This is what we do. So I'm going to share two things. One is looking at, I wanted to share out some information about how do you connect with enrollment assisters, but also how do you help the public, find enrollment assisters in your community. And so there's a variety of ways that you can do that. And right now I'm showing the Covering Wisconsin website, and there's a few things that I wanted to show you here, and then I'll also show you the WisCovered website. One, and maybe this is just the simplest and something that we continue to heavily promote because we know it's easy, is you can call 211. It's an easy number to remember. That's the United Way kind of resource line. Lots of resources that you can get through calling there. Health coverage assistance is one of them. Another is on this enroll button. This is something that we've had for years. It's what we call the connector tool. It's something where you can go in and you or a consumer can simply enter in a zip code, the distance from where how wide the range is you'd like to look at, language information, the kinds of services that are offered, and then you search for help and it shows available assisters in that area. So again, really, this is something that we maintain throughout the year. And if you have been a part of this, if you have been listed, we always look for making sure information is up to date. And if there's additional information we need to clarify on there. If you're interested in being listed, or if you're not sure, one thing you can do is just check to see if your information's on there or if your agency's information is on there. And if not, please do reach out to us. And Caroline Gomez-Tom in particular is leading that effort with us, and she can help you out. And then a third way that we're very excited about, and we have been sharing out information as we've been making it available, is this web chat, this chatbot tool. And so this is something that is available in English as well as Spanish. You can just enter in and kind of some standard responses will come up to help guide people through some of the common questions that we get. And then for the English version, there is an opportunity for a live chat as well during business hours, where if they wanted to just, after going through some of the just standard questions that the chat bot offers and asks, if there's still an opportunity where they say, you know, I just want to talk to somebody, or I want to text with somebody, that's something that we can offer. And so please do share that out as another way that people can reach out and just learn about what assistance is available to them, but also just some basic questions about what they might be eligible for. We know that chatbots are something that we're all seeing a lot more of in all sorts of sectors, and it just is an increasingly popular way for us to just get information. So we wanted to make that available to people as well. And then finally, while I'm here, I wanted to also share WIS Covered. So please do take a look at WIS Covered. WIS Covered is also a resource that we have been pointing people to as a great one-stop shop for just, it's hosted by Office of Commissioner of Insurance, and it's a one-stop shop for finding what is the available help in the state, as well as some basic information about health coverage eligibility and options. And you'll see also that the chatbot is also available on WIS Covered. So these are two main, our website and the WIS Covered website are two great places for people to, again, enter into that opportunity to receive more information. So yeah, so those are some key ways I wanted to make sure to highlight for everybody as how you or consumers can find assistance throughout the state. And please do share that with all of those that you work with and that you serve. And then while I'm here, I also wanted to go ahead and highlight some of the job opportunities that I mentioned that Covering Wisconsin has recently posted. You can go to our webpage, and then as you saw, click down in the About job openings. We have 2 current positions that we're offering, and so please do take a look at both of those. We'd love to have you spread the word for those that you might think would be interested, and to submit their applications. I'm actually going to stop sharing my screen. I think that worked. I think unless somebody tells me like, no, we couldn't see anything of what we were talking about. But at least you heard my words. So please do take a look at our website. If oh, great. Thumbs up. Awesome. Super. All right. Well, with that, I think we can start to shift to our first session. And like I said, I'm super excited for this session with the in part with the upcoming public health emergency. I know there's been a lot more attention among many stakeholders in the state, thinking about how can we just track what's happening. But really, I think there's just been a broader effort to just track really what's been happening on the health insurance front. And then again, how do we translate that into action? So I'm really pleased to introduce our next session moderator, Justin Rivas. Justin is the Community Health Initiatives Director for the Milwaukee Healthcare Partnership, which is a longstanding partner of Covering Wisconsin. In his role, he aims to improve health outcomes and advance health equity through community-wide collaboration. And in addition to overseeing community health needs assessment planning and the Health Compass Milwaukee, Justin supports the partnership's Racial and Health Equity Council and serves as the program director for the Milwaukee Enrollment Network. So with that, Justin, I'm going to go ahead and turn it over to you.
Thank you, Alison, and that was quite the intro. I appreciate it. Good morning, everyone. As Alison said, my name is Justin Rivas, and I'm the facilitator for this session. I know we're a few minutes early technically for start time, so we're just going to start rolling in kind of slowly here because we do have a lot of great content to cover and some really exciting speakers to talk to some different data sources. So as you can see, the session is entitled Health Insurance Data to Action Using Key Data Sources for Enrollment Efforts. And I know some of you may be thinking off the bat that data and action maybe aren't the most naturally wedded words, but I think that hopefully this session will help kind of instill some of those thoughts in our heads. And I also just want to preface that I think a lot of us in our roles either see ourselves as kind of data people or not data people. And or you know the person in your organization that is the data person, and that may or may not be you. And I want us to kind of remove those labels for the next hour and really think about kind of bridging, even if you're not as data savvy, how to use some of these important data sources to really inform strategic enrollment work and outreach work, and just how we're looking at the kind of landscape in our communities of uninsured rates. So with that, I'll go to the next slide. So more specifically, here are the main learning objectives for our time together this morning. We're going to identify and learn about key enrollment data sources. So a few different data sources. And again, this is secondary data or data that we have available to us through either government data collection methods at the state level, at the federal level, et cetera. So specifically about, we'll learn about Medicaid and marketplace data that's available that you can see somewhat locally based on where you are in Wisconsin. We can learn a little bit more about the American Community Survey, often called the ACS data, to understand a lot. There's a lot in there, but we're going to think about enrollment population dynamics and uninsured rates and how to understand that. And then we'll shift to that action piece and really think about how to identify ways to use data to inform and support enrollment efforts. And as Alison alluded to, I manage the Milwaukee Enrollment Network, or MCAN, if you're familiar. We'll kind of talk about some of those examples and also hear from Kids Forward. And we'll also hear some data use cases for really kind of some policy ideas and strategic outreach work. And we'll also have some partners from Milwaukee sharing in that space. Next slide. So I'm really excited to bring this whole panel to really talk through as experts in all these kind of areas I just laid out in the learning objectives. So specifically, these are the folks we're going to hear from today. We have Aymar, who is the Information System Business Analyst at Wisconsin Department of Health Services. He's very much an expert in Medicaid and specific report that we're going to be going through as a group today. We'll also hear from Darcy Paskey, who's an Insurance Examiner Advanced with the Wisconsin Office of the Commissioner of Insurance, or OCI. You probably know these organizations better by their acronyms. And she's an expert. We're going to hear about a lot of exciting data that'll be coming our way, publicly available data. And then we'll hear from William Parke-Sutherland, who's a health policy analyst at Kids Forward, a great statewide organization. And we'll hear a little bit about shifting to the use case of data. And then a couple of my colleagues here in Milwaukee, Alison, who's works with me at the Milwaukee Healthcare Partnership, and also Aziz, Abdullah, who is the co-founder of INPOWER and runs a really engaging media and community engagement site called Healthy MKE out of Milwaukee. So that's our lineup for today. And with that, I'm gonna start shifting to our speakers and welcome Aymar to the floor here, and he can start rolling into his portion of our panel.
All right. Thank you, Justin. Can everyone hear me?
Yeah, we're good.
The thumbs up. All right. So good morning, all. Thanks for having me on the panel this morning. As mentioned, my name is Aymar Sinaise, and I'm a business analyst with the Department of Health Services, Division of Medicaid Services, and I'm from the Bureau of Fiscal Accountability and Management. As you know, like everywhere else at the state, we love our acronyms. So this would sound like DHS, DMS, BFAM. My goal today is just to provide a general overview about the 481 report and what the data is used for. So as shown in this first slide, the report is generated to satisfy a CMS requirement. The criteria was set by CMS. We didn't have any input, and we send these reports to CMS for the national enrollment statistics. Next slide, please. So just some additional requirements about the report. So the report shows an unduplicated count of Medicaid enrollment at a point in time. So this means each member is only counted once. The way we achieve that, there is a hierarchy imposed which assigns members to a single benefit plan, even though they are enrolled in two. Data is by county of administration or certifying county. By this, we mean, if you guys are familiar with the Wisconsin map, you have the consortia, and each consortia is broken down by counties. So as an example, if a member from Monroe County sent in an application for Medicaid and the application was processed by a worker in La Crosse County, then we would count that individual in La Crosse County as the certifying agency. Also, the report includes both full benefit and partial benefit programs, and we do not go back and update the reports. By this, if we were to run this report 2 years from now, we'll get the same count at that point in time for that particular month. Next slide, please. So the 481 report is used to create free publicly available reports. We use the raw data with some manipulation in the back end to create the Medicaid forward of monthly enrollment report, which I think most of you are familiar with, also known as the Medicaid enrollment report. So during this session, you're gonna hear me refer to Medicaid a lot as just MA, just to keep adding to the acronyms we use. And this report provides data on the number of eligible members enrolled in Wisconsin Medicaid and Badger Care Plus programs. We also use the 481 raw data to create the Medicaid Badger Care Plus state and county enrollment, also known as the 481 caseload. This report provides a data table and chart showing the enrollment trend for the past several years, both statewide and for each county certifying agency and tribal agency. And the third thing we use the 481 data for is to create Badger Care Plus enrollment. This report provides information on the number of eligible members enrolled in Badger Care Plus programs over the prior 6 months. Next slide, please. So I'm gonna just do a deeper dive into the MA enrollment report, which I think most of you are more familiar with. This report provides statewide data by coverage type, coverage categories. There's also some trend data, MCO breakout. And we also, for certain coverage categories, we also provide some visual analytics and just additional breakout by FPL or age. And also this report, if you're interested and want to view the data contained in there, is available at the location on this slide. Next slide, please. So as I said, the MA enrollment report provide information enrollment by coverage types and coverage categories. There are 3 main coverage types. We have Badger Care Plus, there's the Wisconsin Elderly Blind and Disabled coverage type, and we have other coverage type. And as you could see, each of those coverage types are broken down by different coverage categories. For example, on the Badger Care Plus, we have childless adults, we have children. On the elderly, blind, and disabled, we have MAP, we have SSI, and also other coverage. We are on the other coverage, we have senior care, foster care. Next slide, please. So the MA enrollment report, we also have some trend data. So we have month-to-month change in enrollment. As you could see for the month of August, looking at a coverage type perspective, we had an increase of approximately 7,800 members in that month. But if we do a deeper dive and look at the coverage categories, we could see children, there was an increase in 307, whereas youth exiting, there was a decrease by 8 members. So just one way to look at the data. Next slide, please. As I mentioned as well, we also provide a breakout by the MCO and the MCO type. As you could see, for the Badger Care Plus HMO United Health Community Plan is where most of our members are enrolled in. Not listed in this slide, but some of the additional managed care plan types. So just take a step back. By MCO, I mean managed care organization. Some of the other managed care types we have would include like family care, PACE partnership, wraparound, Milwaukee, and children come first. The slide was just a little too long to capture everything on this. I mean, the page was just a little too long to capture everything in the slide. So next slide, please. So what we're gonna do right now, we're just gonna look at an example of coverage type coverage category by each coverage type, where we provide some additional breakout. So also in there, I just provided a definition just to let you know what each coverage type entails. So for example, for children, this looks at health coverage for people under the age of 19. The MAP or Medicaid Purchase Plan, it's healthcare coverage for people with a disability who are age 18 or older and are working or interested in working. And for senior care, this is just help with paying for prescription drugs for people aged 65 and older. Next slide, please. So, like I said, we provide some additional breakout for the children coverage category. So this map, this line graph provides just some trend data of how the children data, like for each FPL breakout. As you could see, most of our children fall between FPL 0 to 100. And you could see there is a lot of change within the last few years in that particular FPL group. Next slide, please. We also provide age breakouts for that particular coverage type. And also, you could see children less than 19 captures the biggest portion of that population. As you could see in August, we had 261,000 members enrolled in that particular group. Next slide, please. I'm going too fast. So on the Wisconsin elderly blind and coverage type, we're looking at the MAP coverage category. So we could see a breakout of MAP by those members with a premium or those without a premium. As you could see, most of our members for that particular coverage category has a premium. So it's about 85, well, roughly 86% of that population will have a premium. Next slide, please. Under the other category, we're looking at the coverage type for senior care. Senior care, we have three different levels: level 1, level 2, and level 3. Level 1 is just a co-payment. Level 2, deductible. That's broken out by level 2A, level 2B, and we have a spend down. Just to provide some additional information about each of those levels. So level 1 is just a co-payment. Level 2A, those individuals will have a deductible of $500, and then they will fall down to just having a co-payment. Level 2B, those members will have a deductible of $850, and then they will fall to just having a co-payment. And level 3 is the spend down. So the spend down, just as an example, if a member has annual income of $8,000 and the federal poverty level is $6,000, the spend down will be $2,000. So the member will have to meet that spend down, then also a deductible of $850, then will just have to pay the co-payment, just to give you an idea of how this works. So as you could see, most of our members fall within that spend down category. Next slide, please. So as I said, the enrollment report provides information on the statewide level. If, for instance, someone is interested in looking at the coverage categories on a certifying agency or a tribal level, you could go to our 481 reports located on our website on that link below and look at that breakdown. As you could see, this is just a quick snapshot of the Milwaukee County. As you could see, for August, we had 40,000 people enrolled in SSI and 14,000 in SSI related, just to give you a general idea of that breakout and that granularity of the data. Next slide. And the last thing we use the 481 report for is just to provide information on just if you're only interested in looking at just the budget care plus categories. Also, this information will also be available in the 481 breakout if you just want to look at this as well. But if you just want to focus on budget care plus, you could also find it at the location below for the last 6 months. So that information is available both at the statewide and the certifying agency level. Next slide. And this is just some additional links if you want to learn about a little bit more about the different programs we offer at the state for Medicaid. Those are some links that will provide you some additional information about each program we provide for Medicaid if interested. So that's it. Anyone has any questions, concerns?
Thank you so much, and super helpful. The idea of this was to, I know some of you probably are very familiar with accessing 41 reports and finding your county and tribal localized data, but this was really helpful, I think, for everyone. And I think to better understand people's comfort, I wanted to kind of get through one of these, the first panelist, to kind of just orient you to a data source. We're just going to run a quick poll to get just a level, an understanding of where people are at with this. So we're going to launch a poll, and it's just a basic question around how you describe your current comfort with accessing and using enrollment data. Not specifically this source, it could be this, but just in general, your level of comfort. I think that'd be helpful to know. And while you're responding to that poll, I'll give you 30 seconds or so. I just want to thank Aymar again for his expertise and for really making these links accessible for folks to use. We'll try and save questions till the end. So if you have questions specific to what Aymar went through, maybe just throw them in the chat so we have them captured somewhere, or we'll come back to it at our Q&A. So we'll give you another 10 seconds or so to take that poll. And I think I have to, oh no, I cannot take it. It's just in my way. All right. Mike, did we get some responses in for the poll? And okay, cool. We're seeing this. Hopefully everyone's seeing this. I'm seeing it here. So basically kind of in the middle. A lot of folks in the neutral zone there, pretty equal split, about 18 to 25% of people are either uncomfortable or comfortable, and then far fewer are on the very side, so very uncomfortable or very comfortable. So hopefully this is landing and resonating with folks, and if not, hopefully it's a great refresher for others.
And then Justin, actually, before we proceed real quick, we do have one question. Someone asked, are institutional costs counted towards spend down costs? So for those who reside in assisted living facilities or have to pay for institutional costs?
I'm going to dish that right to Aymar if he's available.
That's a good question. This is more of a policy question, which I could take back, and Justin, I don't know whoever asked, I could get a response to, but off the top of my head, I do not know. That's more something our policy team would deal with more on the data side. Yeah.
Great. We'll take that back, and we know Quintella who asked the question, so we can get her the response.
Yep.
And I got another request to drop some of these links that are on the slides into the chat. So maybe in the background, Jen or Mike could help us do that. And we'll keep cruising with our next panelist. So thanks again, Aymar. Awesome expertise, and we'll come back to you in the Q&A as well. And now I'm going to shift to Darcy and welcome her to the space to talk us through a bit of OCI's perspective on enrollment data here. And I'll let you take it away, Darcy. And Darcy, you're on mute.
There we
know,
go.
right?
How's that?
That's good.
Thank you. Good morning, everyone. I'm Darcy Paskey, and I work in the Division of Market Regulation and Enforcement at the Office of the Commissioner of Insurance, or OCI. Today, I'm going to talk briefly about our agency and give a high-level overview of the health insurance enrollment data that we've been collecting. Next slide. Okay, our mission is to protect and educate Wisconsin consumers by maintaining and promoting a strong insurance industry. Next slide. Okay, OCI was created by the legislature in 1870, and we're still going strong today. We provide a variety of services and perform a variety of tasks, such as issuing licenses to companies, agents, and navigators, and others, monitoring the financial solvency of companies, conducting financial and regulatory examinations of insurers, assisting consumers, reviewing insurance policy forms and rates, researching special insurance issues and assessing their impact on Wisconsin, creating public information and consumer education pieces, providing technical assistance on legislation and promulgating administrative rules to interpret insurance laws. And we operate the State Life Insurance Fund and the Injured Patients and Families Compensation Fund. Next slide, please. We protect and educate the public with regulation, examinations, audits, and complaint handling. The commissioner is responsible for administrating and enforcing the insurance laws of Wisconsin, to act as promptly as possible on all matters placed before the office, and the commissioner possesses all powers specifically granted or reasonably implied by the statutes. The commissioner is also required to examine every domestic insurer. Next slide, please. So now to the data. We are currently collecting enrollment data from 35 companies. We're collecting data on individual, small employer group, and large employer group health insurance coverage. Individual and small employer group enrollment data includes ACA plans, grandfathered plans, and transitional plans. You may also have heard of these referred to as grandmothered plans. And the large employer group coverage includes student health plans. Small employer groups are 2 to 50 employees, and large employer groups are more than 50 employees. Grandfathered plans are the health insurance plans purchased on or before March 23rd, 2010, and the transitional or grandmothered plans took effect after the ACA was signed into law, 2010, but before the exchanges and the marketplace opened in January 2014. So these are the plans that are in between the grandfathered plans and the ACA plans. The enrollment data, though, does not include short-term limited duration plans, limited medical benefit plans, or healthcare sharing ministry plans. Next slide, please. The enrollment data being submitted by the insurers is the total number of effectuated covered lives only. And this is the number of policyholders and their dependents that have paid their premium and are covered under the plan as of the first day of the reporting month. So for example, the enrollment data for September is the total number of effectuated covered lives as of September 1st. So those policyholders and their dependents will have paid their premium by September 1st. And this data is collected on a monthly basis. Next slide. There are two views of the data by geographic rating area and by large counties. There are 16 geographic rating areas. These were developed for the ACA, but we are going to use them for the public dashboard to ensure confidentiality of the data for the insurers. The large county view consists of 16 counties with 100,000 plus in population. Those counties are La Crosse, Eau Claire, Marathon, Brown, Outagamie, Winnebago, Fond du Lac, Sheboygan, Washington, Waukesha, Milwaukee, Racine, Kenosha, Walworth, Rock, and Dane. Technically, we have been collecting this monthly comprehensive data as of January 1st, 2021. However, along with that first January 2021 data submission, insurers also included end of year 2020 enrollment as well. Next slide, please. Okay, this enrollment data will be available on the soon to be released public dashboard on the OCI website. And if you would like to receive more information on the public dashboard, you can sign up for the OCI listserv at oci.wi.gov subscribe. Next slide. So that concludes the OCI presentation. I believe we're holding questions to the end, so thank you very much.
Thank you, Darcy. This is Justin again. Super helpful information, and I think when we discussed your presentation, we were thinking of it as kind of a movie trailer. It's a little bit of a teaser in that what Darcy just talked through will be available. There'll be a formal launch, but you can sign up and get more information on the OCI site. And what I think is really exciting about both the two panelists we've already heard from is that we can find this localized data on a monthly basis. So that's really exciting, I think, for all stakeholders around the state. We do have a few minutes here, so if folks have any questions for Darcy regarding the OCI enrollment data, please drop them in the chat. Otherwise, I know we have a lot of content we could keep cruising with. Okay, I'm not seeing much here, so of course you can save them to the end as well. Thank you so much, Darcy, for queuing that up for us. And now we're going to go on to our next panelist and hear from William about ACS data and how Kids Forward is using it.
Okay, great. Hey everybody, hey Justin, can you all hear me okay?
You're good.
All right, great. Well, thank you so much for having me. It's great to talk to you. I love to talk about data, the American Community Survey. So this is not data that's available monthly. We'll get to that though. My name is William Parke-Sutherland. I'm a health policy analyst at Kids Forward. I'm going to share a little bit about Kids Forward just to make sure you know who we are, give you a brief overview of kind of what the American Community Survey is, a little bit of the landscape of what's available, and then dive into a few examples of how we use the data specifically, as Justin said, related to health insurance and kind of exploring insurance coverage. I'm also going to give you a couple tips as you are using this data, so how to use it and sort of some best practices. So we can jump right in. So Kids Forward, our mission is to inspire action and promote access to opportunity for every kid, every family, and every community in Wisconsin, especially children and families of color and others furthest from opportunity. We are a policy kind of research analysis advocacy public education center that through research and community engagement kind of strives to create upstream solutions or remove barriers upstream in areas of health, early childcare education, economic security and kind of tax and budget issues, immigration and juvenile justice issues. So jumping into the American Community Survey. So, you know, this is, it is according to the census's website, it's the nation's most current, reliable, and accessible data source. It provides lots and lots and lots of information for all different population groups, looking at employment, housing, all kinds of different things. Nationally, it surveys 3.5 million households or addresses. In Wisconsin, this year, more than 100,000 households were surveyed, and about 67,000 households responded. So that's our sample size in Wisconsin, is 67,000 households. It directs, billions of dollars a year in spending. And it's accessed sort of through 3 different data releases that happen over the course of a year in a usual basis. There's a 1-year estimate that's good for larger population geographies like states or larger counties, particularly counties with 65,000 or more people. There's a 5-year estimate, which we'll talk a little bit more about, but goes in and looks at over a 5-year period, does some averaging, has certainly a higher reliability threshold and a lower margin of errors. The data is more reliable, and that can go down, to census tracts and even block groups, which are really targeted, and certainly can look at all of the counties in Wisconsin, for instance. So next slide. So there's 2 ways right now that one way you can access the data and one way you will be able to access the data. So data.census.gov is a good place to get started. So if you just search, this is just a screenshot from their website. If you search for what you want to look for and where in a year, you can start to get at some of that information. Some people find this is called the subject table database. Some people find this a little bit hard to navigate and find that that a list of the ACS tables, what's available, are actually a little bit easier. And so there's a good resource that has a list of all of the tables that you can access. That you can do if you don't sort of understand the keywords, right? So if you're looking for health insurance data, but you might type in coverage, you might not find the health insurance table, for example, right? But if you go to censusreporter.org/topics, hopefully that can get put in the chat, or I can do it after my presentation. That's a good place to get a list of all of the tables, and then you have a better sense of sort of what all the data kind of could look like. Also, this data will be available on Wisconsin's coverage dashboard, the public coverage dashboard that Darcy mentioned. So we're going to have a way to present that information, particularly around health insurance and sources of coverage, so that you can kind of dig into that without having to go into any of these federal data source systems. So another teaser. Very excited about that. So this is just a graphic to try to explain a little bit about the differences again between 1-year and 5-year data. So 1-year data is collected over a 12-month period. There are some other surveys that are a point in time, so like they'll survey everybody. This is more reliable. And then again, the 5-year data is over 5 years. That data is all kind of grouped together. It can go a lot lower. It's a lot more reliable. If you are wondering sort of which data to use, 5-year data is more reliable. There's really just sort of no way around that. If you have state data, or you have a large county like Milwaukee or Dane, or really any county that has 65,000 or more people, then the 1-year data, can also be used. 1-year data is likely to show kind of fluctuations because it is, again, 1-year data. 5-year data is more likely to show kind of less jump and more of a smooth trend, because that data, again, is pulling data through a 5-year period and then averaging that out. And so some of those, some of the dips and things are going to be kind of smoothed out. One thing to remember when you're thinking about using 5-year data is that you don't want to use overlapping 5-year estimates. So for instance, you wouldn't want to compare 2018 and 2020 5-year data, right? Because that's going to encompass periods where the data is going to be the same, right? So the 2020 data is going to be 16, 17, 18, 19, and 20. 2018 data is going to include some of those years, right? So you don't want to do that. You'd want to take 2010 5-year data and 2015 5-year data. Another word of caution is that when you are disaggregating the data by race, which for ethnicity or gender or physical ability, or language spoken in the home, there's lots of different ways to disaggregate the data. That those numbers get even smaller. And so when you're thinking about 1-year data, even if you're disaggregating by race, if you're looking at a smaller county, you might want to consider again using that 5-year data if you don't need to kind of understand specific, maybe, or think about specific impacts of a policy decision that happened, right? So one of the problems with 5-year data is that because it's going to include all of that information, right? Like if you wanted to track open enrollment over a certain period where you saw like 3 different policy level changes, shortened open enrollment period, less funding for open enrollment work, if you had 5-year data, you might not be able to kind of see that, right? Because everything would be kind of averaged together, right? And this comes from a great organization called the Illinois Early Childhood Asset Map. Stole this from them. Great data tips. Next slide. So again, this is just a sample of some of the available data. So don't have to go too much into detail here, but one thing I want to point out is that the health insurance section there also has different sources of coverage. So Medicare, Medicaid, coverage purchased by an employer, coverage purchased privately, TRICARE, VA services, and then also Indian Health Services. For any of the people who want to really nerd out or really understand what some of these subjects mean, right? Because we could have a long conversation about what you mean by fertility or what you mean by race or what are we talking about, right? There are things called the subject definitions. So you can go to the census website and look for either technical documentation, or you can actually Google subject definitions, and you'll find a long but very useful document that says, here's what we mean when we say health insurance, here's all the different health insurance we collect, and here's the assumptions that we've made. So one really important example of this is that for people who have only insurance through Indian Health Services, the American Community Survey data considers them uninsured. And that's something that you might not know without digging into understanding how they're thinking about those subject definitions. So it can be really important in understanding the context of the data. Next slide. So again, a couple more tips for the use of this data. Be consistent. Don't compare, really don't compare 1-year data to 5-year data. If you're going to use 1-year data, then use 1-year data for everything that you're comparing. If you're going to use 5-year data, use 5-year data for everything that you're comparing. And again, 1-year data is available for 23 counties, 23 of the largest counties, and then 5-year data is available for all the other counties. But 5-year data is available for all 72 counties. So if you wanted to look at all the counties, you could use 5-year data to look at that. And again, 5-year estimates are often best because they're often, I mean, they are the most reliable. So now I'm going to go into a couple examples for how we've used data. This is from the 2018 community survey. Oh, Justin, go to the next slide. I'm sorry. So, we use this data to call attention to significant racial disparities that still exist in Wisconsin and have existed for as long as the American Community Survey has been collecting data, and longer than that, obviously, everybody knows. So this looks at, this uses 1-year data at the state level, looking at the percentage of people who don't have access to health insurance, disaggregated by race. So you can kind of see this, but again, right, if you're thinking about knowing what the subjects are and thinking about how we're thinking around who's insured and who's not and what counts as insurance, that might be one of the reasons why, one of many reasons why for American Indian or Native Americans, that number is as high as it is, right? So I'm thinking about like what we're comparing. Next slide. Another example of how we use the data. This is a little bit more kind of using the data and then doing some of our own calculations. But this is comparing Wisconsin and all of the states that expanded Medicaid. If any of you have heard me talk before, you've probably heard me talk about Medicaid expansion or Badger Care expansion. And then the states that didn't. And so what we did here is we looked at the percent change in the number of people who didn't have health insurance from 2013 to 2018. So comparing pre-ACA and post-ACA. And so what we see here is that Medicaid expansion states, their share of the percent of people without insurance decreased by 48%. Non-expansion states decreased by 23%, and Wisconsin was kind of in the middle, doing pretty well, but clearly sort of shows that we could be doing better, probably, and if we expanded, right? So that's sort of the only, we're the only state in that middle ground. And then another example, this is again using 1-year data, is because we want to track what's happening with coverage. This is throughout the state from 2008 to 2018, and it just shows how we're doing, as far as insurance rates. And looking at the important thing here is sort of showing that over, we've been going steadily down and having more and more people covered. And that change kind of stopped in 2017. We started to see insurance rates and uninsurance rates tick up a little bit. So a couple other kind of tips or just words of caution, I suppose. It's really, really important that you understand that data without context most likely misleads. I think I wrote can mislead, but I'm going to change, most likely misleads and tells the wrong story. So an example of that, right, is if you're also thinking about health insurance by citizenship status. There are rules in the country and in the state that specifically preclude certain people who aren't citizens from accessing certain kinds of health insurance coverage. That's not their fault. That's a function of our federal and state laws and structures. And so understanding, those kinds of both historical and current structures, barriers, makes it a lot easier to understand what you're looking at, right? And allows for less opportunity to kind of fill in the blanks with either harmful stereotypes or the wrong stories. The other word of caution, we're thinking about health insurance in specific, and I'm sure this is something everybody here knows, but health insurance, doesn't equal access to care. It doesn't equal quality care, and it certainly doesn't equal health outcomes. So, when we're thinking about health, I think this is probably something everybody knows, right? But only about 20% of people's actual health is attributable to the clinical care that they can access. And so, oh, Justin, can you jump to the next slide? Sorry, I'm not paying attention because I'm paying attention to my own slides. We know that health and health outcomes goes way beyond access to clinical care. And we're thinking about health insurance coverage data from the American Community Survey. We're even one step below, right, access to clinical care. So this data is really helpful, really important, but it is just one tiny kind of foundational piece. And actually what it means, for us to be healthy. And again, this is social and political determinants of health, showing, that the vast majority of people's health is related to built environment, social and economic factors, political factors, where people live, what kinds of resources and food and other kinds of things people have access to. So again, the limitations of health insurance data. I'm trying to keep it here. If you'd like to email me, I'd be happy to talk. If you want to dig more into the data, I'd be happy to nerd out with you. Please, that's my email. Please feel free to reach out, and we have questions at the end. So thank you so much.
Thank you, William. That was an awesome overview of the American Community Survey. It's such a huge data set, and it's often there's whole other websites that are devoted to just manipulating and modeling that data into other indicators. So I really think it was such a great presentation to cleanly explain the 1 in 5 year estimates. I think your tips were fantastic, and I really appreciate coming from my perspective that social determinants of health and understanding that distinction between health insurance access and also other things that lead to health outcomes. I really appreciate you acknowledging the limitations of the data source too, knowing that surveys and data aren't perfect, and definitions. I know there's a lot of contention around the categories in race and ethnicity and how those can be better changed, and I think there's movement in those directions, but it's also a big federal data set, so it takes a lot of time to make progress. So I just want to thank you again for a great presentation and your insights and that transition from this data to kind of the policy implication. I think a question popped in. Yep, we got his email address. William, we got your email address there so folks can access that. Are there any other questions for William with a few minutes here to spare? All right, we'll take time to brew on those. And I think we'll just pause here and launch another poll to keep everyone engaged here on, since we've been through these data sources. I'm just asking folks what you've used before in the past in this role and other roles. Are you familiar with these data sources? Have you accessed them? And I think you can select all that apply if you've been using more than one. So go for it. We'll take about 30 seconds to run through this poll. We'll get an idea of not just the comfort from before, but the actual utilization.
And just for the recording and those who are on the phone, the poll question is, please select the data sources that you've used in the past. The options are Medicaid data, DHS 401 report, marketplace data, American Community Survey data, or other data sources. So we'll give just another about 15 seconds on that before we close that out.
All righty, thanks, Mike. So it looks like about 37% of our group today has used the Medicaid data. That's great. So yeah, roughly a third there. Over half have used the marketplace data. Fantastic. So some refresher here. Only 6%, so 10 folks have used American Community Survey data. So that's great that William was able to share those details about ACS data. And then over half have used other data sources. So great. I think just to build on that, while we move into the next section, people that have used other data sources that they think are helpful for their work, maybe if you just want to drop some of those in the chat, maybe your location or organization too, that'd be great. So we can kind of have some shared learning in this space if you think you have a great data source that would be good to share with the group. So go ahead and do that. And I'm going to shift us to our last panelist from Milwaukee, who work on some really great kind of the action piece. So taking this data, all the data we've talked about, and putting it to action. And I'm going to hand it off to my colleague, Alison True and Aziz Abdullah.
Great. Thank you so much, Justin. Great to be here. Really happy to talk with you all. We're going to talk today with myself and Aziz, and I'll let Aziz introduce him when I pass it to introduce himself when I pass it to him. But I think we can go to the next slide, please, just to set the stage. So what we're really hoping to do, really great to see in the panel that many of you have are familiar with those data sources, are familiar with other data sources, are looking at data, are thinking about data. But I know at times we can, have access to all these sources, be looking at it, be thinking about it, but then that next step to what do I do with it can be a little gray or not quite sure how to review it, how to use it, how to actually help it improve your work with health insurance and coverage, enrollment and retaining coverage. So what we're going to talk about today in the communications arena is how we look at and use data and what we do with that data, how it informs our work, and how we make sure that everything we're doing is coming from some sort of a data-informed space. So Aziz, I'm going to pass it to you and have you talk a little bit about our process. And when I say our, I am talking about the Milwaukee Enrollment Network that, as Justin outlined, he manages and the partnership co-sponsors with Milwaukee County. So all of this kind of work that we're talking today about that Aziz will get into is what we do with the Milwaukee Enrollment Network in Milwaukee County. So Aziz, take it away.
Perfect. And I think we can transition to the next slide also. Thanks so much for that introduction, Alison. As she mentioned, my name is Aziz Abdullah. And over the last 3 years, I've had the great fortune of working alongside the Milwaukee Enrollment Network and supporting with some of the outreach and education during open enrollment. And so, as mentioned, today we just wanted to go into, again, in this ecosystem of data, whether you're a benefits specialist, a health promoter, a health insurance navigator, if you work in a communications department, or if you're just representing an organization today, hopefully we give you some tools and some resources to be able to take back within yourself or with your team, just to think about, as we get into this next season, how can you approach and actually have some use cases around some of the great information that was shared today. So we'll start off with, again, kind of on that previous slide, assess, application, and then adapt. And so we'll start with the assessment around, normally this for us is a 3-step process, grounding in goals. In addition to some of the data sources that were shared, we'll share some of the other ones that we use, and then also touch on some of the key audiences that we've identified specifically to Milwaukee, but this Alison will kind of speak to how we shape this from some of the data sources that were shared today. So next slide, please. So outside of kind of just the general data space, I wanted to at least be able to start with kind of what I call the good thinking of journalists when they're getting ready to go and approach a new story or do new work. And that's really the who, what, when, where, how, and why process. Ultimately, because as we go into this season and we go into this work, this is also a time where when most people are getting ready to wind down at the end of the year, for many of us that are on this call, we're actually winding up to do some of the most important work. And that's obviously getting people connected to access through coverage and making sure that people go into the new year with, a rest assured mind of being able to ensure that they can access healthcare that they deserve. And so I won't necessarily talk specifically in the Milwaukee market about kind of our framework, but I think it's always important as we're getting ready to approach a new season, a new project, a new time or energy in the work that we do, that we always ground ourselves both internally within our organizations, within ourselves, but also within our communities to really, move forward and understand, why do I do this work? Why do I sometimes go out to community events on Saturday? What is really driving me to make sure that at the end of the day, I stay motivated in this work. And I think that bottom line point again reinforces kind of, health insurance is really the key to access and care, regardless of what community you come from, and every person deserves to have access to it and to be aware. So we always start with grounding ourselves in our goals, and some of those other factors are more related to what we do within our market. But again, you may represent or be in a community where it's predominantly a rural population who may potentially lack access to digital broadband. And so your what may be a little bit different, because you may be focused on how do I ensure that folks in our community get the information that they need in the way that they're going to need it. And we'll talk a little bit about that in our tactics section today. So next slide, please. So once we get grounded in our goals, what we really make sure is kind of, again, what you've learned on this presentation, how do we access the data resources that are available to us, just to learn, who should we be reaching out to, or where do we have an opportunity to have a significant impact and really move the needle when it comes to overall making sure that coverage within our community is increased. And so on the screen, especially in that top line and some of the second line, are some of those resources we use to really identify where we're at from a coverage standpoint in our community. And the second half really kind of goes into a little bit more of some other data sources that you may be interested in using within your work. And so I'll talk a little bit about how we use Nielsen, but Nielsen is really a media and audience reporting and insight company. They publish a ton of reports, and I'll make sure that we share in the link an example or their link, and you can look at some of the examples of the reports. They're free, and they just offer a little bit of insight around media and consumer behavior. Google is another great resource, and I'll drop the link. They have a platform called Think with Google, and it just kind of talks about the #1 websites that are being used within a specific audience, or some of the other consumeristic behaviors when it comes to where people are getting their information. And then that last little quadrant represents what I'd say is one of the more important pieces around data engagement and insight, and that's focus groups, community engagement, and really talking to the expert of your strategy, which is the people that you're trying to reach. So really just getting out and having conversations once you get that initial kind of framework around the who that you might want to reach. So on this next slide, I'll hand it to Alison, who will talk a little bit about some of the key audiences that we've identified this year. And again, this was informed by the data that Darcy, I think, spoke to a little bit earlier.
Yeah, thanks, Aziz. And actually, I think Stephanie, our colleague at Covering Wisconsin, called this out in the chat that this year we were really thankful to OCI and to a number of our partners that worked together on this to have the OCI market scan report, which gave us really good insight to our uninsured populations, our insured populations, why people do or don't have insurance. And in addition to all those data sources that Aziz mentioned, we really relied on what we learned from that report as well. So when we think about our audience, we know we don't have a message to everybody reaches nobody. So we really want to make sure that we're focusing on a group and thinking, who are we looking to move? And this year, looking at the audience, and again, much of this was learned from that OCI market report that I know we can put that link in the chat, is that individuals with lower income are substantially more likely to be uninsured, as are persons of color and Hispanic Latinos of any race. So we know right now that we need to be looking geographically at our folks that live in low income zip codes. In Milwaukee County, that frequently equates with racial inequity. So we are able to kind of use geography as a proxy for race in Milwaukee County. That may not be similar in all of your counties. What we also learned and has been apparent, we see across the data, is that young adults, so folks 18 to 34, really account for the declining portion of individual market enrollees in a substantial amount of our state's uninsured. So when we see the celebrating the increasing rates of marketplace enrollment, we are seeing that among young adults, that just doesn't equate. So we know we need to focus on young people in low income zip codes, frequently equating to people of color. So everything we build from there, what we say, how we do it, is focused on them, their attitudes, where they like to get information, etc. All those things Aziz went over. Messages that we made sure we had to focus on, again, information from that report, is that consumers are frequently citing that cost is the main reason for not enrolling. So we need to make sure one of our messages is very cost-based. Thanks to our friends at Covering Wisconsin and OCI, we're lucky to have a very collaborative relationship, and we all work together on messaging and strategy, and have other insights into how people react to that cost message. So have been able to even drill that down more to a more effective message. Also, we know that people really just don't know their options. They don't know what's out there. They don't know what subsidies are or that there's support. So really need to make sure that that's center, and that people just think they don't need it, right? And that's a typical, I think, point of view from an 18 to 34-year-old person.
Can happen within the framework of focus groups. This can happen with testing with some of your colleagues that may have experiences with the audience that you're trying to reach. Friends and family are always a great resource. People that keep it honest with you, keep it real, and tell you, how they may perceive kind of something that you've developed. And also, again, your clients and your existing networks are big experts in helping test kind of your ideas around how you want to use some of the information that you maybe put together, especially from an outreach and communication standpoint. So on this next slide, one of the use cases, and these are two examples of kind of looks and feels that we developed this year in Milwaukee. I do want to reflect back to some of the points that Alison brought up. We're really targeting a younger audience, and what we know is, art and culture are really big in those audiences, and expressing artistic behavior is something that a lot of people gravitate towards. And so these are examples of kind of some of the images that were developed within some of the testing that we've done this year. But one of the things I always call out, and I think, within our work, OCI's work, as well as Covering Wisconsin, there's a lot of different options of materials that you can use. And so, you may personally have a favorite asset to use, but I would always recommend to have two different resources, because you may identify that you're at an event, you're using one material, people may not be as engaged with the material, but then you use another, and people are really gravitating and interested in what it is that you might be sharing. So it's always really important to kind of have what we would call an A/B test. And this is just a way to identify, is my A message working best, or is my B message working best, and how do I continue to build on it? And so again, there are a few different resources that you can use across the state to be able to leverage this within your own organization as you're doing outreach this year. So on this next slide, this is one of the big pieces that is really driven by channel. And so channel is really just, how do you develop the strategies that you're going to use to reach the folks that you're trying to reach? So if you are, again, focused on a younger audience and a younger population, you may know that social media is going to be one area to focus on. You may identify that like activity or event spaces are really somewhere to focus. But again, the question to ask is kind of, where's my audience getting the information that they're getting right now? And another question may be to ask, where are they currently hanging out? So, here in Milwaukee, we have a space called the Sherman Phoenix, which is a local marketplace. We have farmers markets that are still happening into the fall. And so we're using some of those resources and locations to really identify who and where is our audience hanging out and what is some of the best ways to reach them. So again, kind of in a retrospective space, once you know the ecosystem data, then you identify the audience that you really want to focus on, or the audiences that you want to focus on within that data set, really identify messages that can be tested and identified that are going to work to really gather the attention of the folks that you want to do some of the work with. And then ultimately, what are the strategies that you're going to be using to really test with some of those folks as you move forward through this season? So that's kind of where we go from assess to apply. And this last section is a little bit of a shorter section, but it's really how do you adapt? And so on this next slide, we really talk about evaluation and measurement. So one of the ways to do this, I'll use an in-person example, is maybe have a sign-up sheet. And so if you have a way to be able to just understand, or a clicker or a ticker, but just understanding how many people did I talk to at this event and engage with, and being able to build that kind of baseline of, I want to work towards this on a week-to-week basis. Some of the other examples that we use in our evaluation and measurement, you know, if you have printed materials, having a QR code on there, and that's something that is a free resource, is available online on Bitly, where you can track how many people responded to the information that you handed out. The other thing is, if you're using online resources, you can measure obviously through some of the data and analytics around website activity. And then again, that last example is kind of at least have one way to measure how many people you're talking to and figuring out when are people most receptive. It's always good to go back. Data is ultimately a reflection of a story that can be told to inform our future. So really the evaluation and measurement falls into that. And then on this last slide here, it's really being comfortable with making changes in real time. When you're doing outreach work, when you're doing engagement work, when you're talking to, you know, individual patients at your clinic or within the space and setting that you're doing work, it's super important to just use the measurement tactics that you have to continue to improve throughout the season. Use some of the public sourced information that we're going to have over the next year to evaluate what's happening in your local community, because you may be doing really well in one audience, but may need to make some changes to reach another audience. And again, within your own work, if you don't have any data available, it's always great to start with the baseline, because that gives you the opportunity to continue to build and improve and move forward with different strategies. So I'll close with that. Again, kind of the takeaway, and on this next slide is really kind of the walkaway learnings that we hope you've had. Oh, sorry, one more slide. But again, it's really 3 points. Use your available data sources. Your audience is really your expert. They'll tell you kind of how to reach them and what are some of the best ways to do that. And always use real-time data opportunities to measure and evaluate what you're doing to ultimately adapt, and never be afraid to make changes in real time. So I hope you can walk away with some of what we applied today. And again, I know some of the links that we referenced in the call will be shared out.
Thanks so much, Aziz and Alison. As usual, Aziz, you're getting a lot of love in the chat here. And your creative content always excites me whenever I see it. So I'm always excited to work with you. It's been so great to have such data experts on this panel, and obviously communications experts as well here to kind of make that jump. I just wanted to take these last 5 minutes for folks to jump in with any questions for our panelists. Please drop those in the Q&A. We do have a few that came in. One specifically, his or her name is anonymous attendee, is about how do you think, due to the state of our economy, will it affect the number of those declining to enroll in coverage this year? I think that we talked about that a little bit with when Alison alluded to some of Stephanie's work at Cover Wisconsin and Aziz's work, and how we're really driving the cost messaging and knowing that. And Aziz, maybe if you want to mention the money is tight campaign plan, and how really getting to that understanding of that's a main deciding factor.
Yeah, I'll just add that was called out in the OCI market scan report, and it informed one of the messages that we're going to be using this year, which is money tight. question mark, there's a plan for you too. The real call to action there is to, even if last year or year before, I think I'll just shout out Beth from a local clinic here, which is at Bread of Healing, which is a community-based clinic. She talked about the importance of telling folks to just check again and to really, this is where we're standing up covering Wisconsin navigators, because we know that, and navigators in general, we know that sometimes it can be difficult or disheartening to evaluate a number 1 year and just have that as kind of impressed on your mind. So one of our messages is really focused on the financial aspect. And even if you've checked in the past and it maybe hasn't fit your budget, check again. So I don't know if anyone else has anything to add to that.
I'll just also note that a shout out to our friends at OCI and Covering Wisconsin. Everyone, all three orgs are doing some really great cost-based messaging. So there would be resources to use from kind of all three different sources that have really good strategies that may align or resonate with audiences differently. So check those out as well.
Thank you both. I got one more here. I know we have 2 minutes left. Brandis asked, what if you have never used any of the data systems or sources? So really, how do you even get started? I don't know, William, would you have any comment on that? Or
well, the ACS data actually has a whole series of introductory webinars that are really good and go from a huge range of like, do you want to do really complicated stuff? And do you not know what a chart is? And so you can start at, wherever is comfortable for you. They're recorded, they're available on their website, data.census.gov, or you can just search YouTube for them too. And they're a really good place to start. I would say that I think the thing that people, you don't have to be an expert to understand the data, to look at it, to look at a table, to think about what it means to you. And I think some of what Aziz said was like totally spot on and right. And lots of people know about this already. And just kind of getting started is the most important thing. And yeah, those webinars are great.
And I think that to William's point, we talked a lot about secondary data, right? But Aziz also talked about primary data, collecting data, whether it's through focus groups, whether it's through evaluation techniques, clickers at in-person events. So, knowing that there's different types of data that you can access to. I'm going to drop or have someone else drop in the chat. I used to work at County Health Rankings, and they have really good quick tutorials too on just kind of data fluency, just basics on data. They're kind of entertaining ways to just learn a little more. So maybe we can drop that in. And then Alison, I got a request for that quote you had about reaching out to everybody. And I don't know what it was, but someone wants to hear it again.
Yeah, something along the lines is when you're trying to talk to everybody, sometimes you talk to nobody. So it's just a commentary on if you can identify more subsets of a population or an audience. Aziz talked through the personas. It just helps you tailor the messages better and know who you're talking to. So for us to know that we're talking to youth specifically, just as an example, that really, really narrows down what we say, how we say it, where we say it. And that's going to resonate much better if we just than us trying to do a broad message that resonates with 65 plus and 18 to 34 and everybody. So at MCAN, we try really hard because we can, and where we are a specific, county, to identify the audiences as best we can, and then tailor and target the information and strategy to that audience versus just kind of a broader message.
Thanks, Alison. Really helpful info. I want to thank all the panelists. It's been a really engaging session. Hopefully we made data a little exciting for you early on a Friday morning. So a big thanks and shout out to Aymar, who I think had to jump off, Darcy, William, Alison, and Aziz for their expertise. And I hope you all have a great conference, and I'll pass it back to Alison.
Super. Thank you so very much. Yes. Oh my gosh, such a wealth of information. I've learned a ton and just excited to see so many faces and such wonderful information about how do we, use all the data that is available, and then also how do we think about that for informing just our work and our action. All right, well, we are going to take a break. We will come back for our second session of the day to talk about scams and misinformation. And we will see you again at 10:45 at the same link. All right, thank you so much, everybody. Well, welcome back, everybody. And we're super excited to be having our second session today on this Friday. And I think we have all of our moderators and guests for this session, so I can go ahead and turn it to them. We have Stephanie Sievers, who is covering Wisconsin's Health Literacy and Communications Manager. So I will hand it to you, Stephanie.
Thank you, Alison. All right, let me share my screen. I'll get the PowerPoint loaded and we'll get started. It sounds like I also need to close out my email. Hopefully it won't continue to ding. All right. Okay. Great. Okay, so oh, I just realized, I'm sorry, I just have to 1 second. All right. There we go. All right, great. So this session is called Scams and Disinformation. And we really want to talk about helping consumers navigate all of that information that's out there and what to do when they fall for some type of scam or disinformation. Okay, and we have 3 presenters today. We have Christina Keeley from the Office of the Commissioner of Insurance, OCI, as we all commonly refer to them. And Christina supports the work of 3 specialized units within OCI's Consumer Affairs section, which are primarily responsible for investigating consumer complaints to ensure agent and company compliance with Wisconsin insurance laws and regulations. I also want to welcome Lara Sutherlin. She is the administrator of the Division of Trade and Consumer Protection at the Wisconsin Department of Agriculture, Trade, and Consumer Protection. She's an attorney with 13 years of practice at the Wisconsin Department of Justice in the area of consumer protection, where she investigated and litigated regulatory matters in all types of industries. And also Teresa Schmidt. She's the director of the Mercer Public Library and the 2022 chair of the Wisconsin Association of Public Libraries. She holds a master's degree in library and information science from the University of Wisconsin-Madison and has worked in public libraries for over 20 years. So as you can see, we have quite a really knowledgeable panel, and we had a hard time consolidating information into one session. Each of these 3 speakers could easily fill one session on their own. So I'm quite excited about this presentation. So let's see, I'll go ahead and talk about the agenda so you get an idea of where we're going and what we're going to talk about. So first, we're going to define misinformation and disinformation, do a little bit of level setting, and think about what those mean in the context of scams. Identify what scams look like. So we'll look at some actual real scams that have gone out in Wisconsin, and then give you some strategic tips for educating consumers and preventing scams. And then what to do when a consumer has fallen for a scam. So what are those steps that you need to take? All right, and I will turn it over to Christina.
I think you're turning it to me first. maybe.
Oh, I'm sorry, Laura.
No problem. Good morning, everyone. Again, I'm Lara Sutherlin, and I'm super happy to be here. And I'm also happy, so thanks for inviting me. And I'm happy to start where Stephanie asked me to start, which is talking about the Bureau of Consumer Protection and what we do. Because oftentimes people don't know, and that's pains me. So, so we're the Bureau of Consumer Protection. We're the state's largest consumer protection agency, and we're housed at the Department of Agriculture, Trade, and Consumer Protection. So we are 3 letters of the acronym, but oftentimes it gets shortened to the Department of Ag. And just briefly, I'll say, you know, we are an agriculture state. The economy sort of is embedded in agriculture, and it's the beginning of the state. And that is why consumer protection has been tied to agriculture. Obviously, we do much more than that, but that's why we're where we're housed. We have a long history of weights and measures and consumer protection that's tied to agriculture. But our mission now has expanded, and that's to ensure fair business practices for buyers and sellers. And that's so we have a fair marketplace for both businesses that are operating within the law and those that are trying to operate, you know, honestly. We want to make sure that those that aren't are held accountable. So we have an entire system set up around that. And our Bureau has over 60 rules and regulations that create that framework to create a fair marketplace. So next slide, please. We do a number of things. We operate through Wisconsin Consumer Protection Hotline, and I'll probably talk more about that later in the conversation when we talk about complaints. But this hotline is staffed by consumer protection experts, and we field questions about all kinds of consumer protection issues that some we have jurisdiction over and some we don't. And that's important because if you call this hotline, we're very adept at figuring out which agency has jurisdiction and where, when we don't have jurisdiction, where we can send your complaint. So it's a great hotline to have. We have a ready resource guide. We know a lot about what the rest of the state does and what we do. So when folks get to us, if we can't immediately answer their question, we'll get them to a resource that can. And we field over, you know, we have thousands and thousands of calls a year. We had 11,000 complaints, written complaints last year. Those come into our mediation unit, and we mediate those complaints with the businesses. And where we see patterns of violations, or we see maybe a really significant violation after one complaint, we'll investigate those complaints for potential violations of consumer protection law. And if we think there's a violation, we either enforce it ourselves or we refer it to a DA or the Department of Justice. The other thing we do a lot of is prevention and education, and that's, you know, sort of the third leg of our stool. So we do a significant amount of education in libraries such as Teresa Schmidt's and other places. So we have a sign up on our website where you can ask for education for community centers, for schools, any kinds of locations. So we encourage you to look at that if you're interested. We administer the do not call law for Wisconsin. We obviously provide identity theft assistance and education because identity theft is skyrocketing and one of the biggest issues facing our, you know, the world and our country for sure, and certainly in Wisconsin. So we do a lot of work around that. And we regulate hazardous consumer products, and we enforce environmental regulations. So we do all kinds of things with these 60 rules and regulations. So we encourage you to visit our website, learn more about what we do, and you know, engage with us that way. And I think next slide is to Christina.
Thank you. You heard a little bit about OCI's functions from Darcy Paskey earlier this morning.
Christina, I'm sorry, your sound is a little bit hard to hear.
Is it hard to hear? I may need to go to my headset. My speakers or microphone isn't great. How about now? Is it better? No. All right. We're gonna do the headset. 1 second.
That sounds much better. Thank you.
Does it sound better already? Okay. Sorry about that. So with my lovely accessory in place. You heard a little bit about OCI's functions already this morning from Darcy Paskey, but to reiterate, our office is responsible for protecting and educating Wisconsin insurance consumers by maintaining and promoting a strong insurance industry. In short, that means promoting fair treatment of consumers, ensuring solvency of our insurers, and ensuring adequate, healthy, and competitive insurance market. Next slide. The two main divisions within OCI are our financial regulation division. They are the ones that focus on financial solvency and the financial health of our companies doing business here in the state, and market regulation, which is the area that Darcy Paskey works in with market analysis and running lots of our data and understanding what's happening at a really detailed level and regulation, and consumer affairs, which is the front line of investigating complaints against any regulated insurance entity, complaints against insurers and or agents. And our consumer affairs team is divided into 3 groups based on the line of business that the complaint pertains to. And we typically handle between 3,000 and 4,000 consumer complaints each year. Next slide. And I'll turn it over to Teresa.
Okay, thanks so much for having me here. So when Stephanie reached out to the library community for help with this presentation, I was excited because I actually, and she wanted me to be sure to tell you this, I actually didn't know about the work that you do. I didn't know about Covering Wisconsin, and I didn't know about the work that all of you do to connect consumers with health insurance resources. And I think it's important that we try to build that communication between us, because there are libraries everywhere in the state. There are 381 public libraries that filed a report with the State Department of Public Instruction last year. There are even more tribal libraries, community libraries that are not officially public libraries. And so we are sort of the frontline resource for a lot of consumers in most communities in Wisconsin. Public libraries are organized into 16 public library systems. And so I put the map of those systems up here on the page for you. The reason I want you to know about that is that if you want to reach out to libraries in your area, public library systems are a great way to do that, because they have instant contact to all the library directors in your area. They can help to organize programs on a larger scale than just working with a single community. So, and then I'm also this year's chair of the Wisconsin Association of Public Libraries, which is a division of the Wisconsin Library Association. And WLA does a lot of outreach with other state organizations. We're working on programs right now with the DNR. We do all kinds of collaborative activities. So one thing that libraries are really good at is focusing on information literacy. Most of us do technology training of some sort. We offer classes, we offer one-on-one technology help and reference help. We offer programming for all ages. We partner with community organizations such as the Bureau of Consumer Protection. I've hosted their staff several times for programs at my library. So libraries are about more than books. If you haven't been in your local library recently, I suggest you try to visit, because we can be great partners for you when you're trying to reach your communities. Next slide, I think I'll take us into the background for today's presentation. So just a little background for you. Misinformation is by definition, it's false information, but it's not specifically created to mislead. So often you see misinformation from people who just want to be helpful. For example, this crazy poster that was on somebody's bulletin board talking about how to find high pH foods that can help protect your health. But of course, if you know anything about pH and if you know anything about foods, you know that these numbers are kind of wacky. The pH scale doesn't go to 22.7 for dandelion, for example. So this wasn't created because anybody's making money selling you dandelions. This was created because somebody wanted to be helpful and they wanted to, I don't know, share some information that they thought was useful to them. Next little piece. This is another example. You see a lot of misinformation. People, again, who want to be helpful, they'll share something about a missing person or maybe a missing pet. But it turns out that that information might be outdated. It might be misleading because maybe that missing child isn't actually missing, but was escaping an abuse situation. So there's all kinds of reasons why misinformation gets out there. But the definition is that it's not created because someone's trying to make money on it. Next slide, please. So disinformation is a little different. Disinformation is information that is incorrect and it is created specifically to mislead people for political or personal gain. And it's a huge problem. 67% of Americans believe that fake news causes a great deal of confusion, and trust in media is declining, as we all probably know from our own experiences online and talking to our friends and neighbors. The creators of misinformation may want to influence consumers when they're making product decisions. They may want to influence voters. They may want to just boost their own social standing so that they can earn money, for example, on a speaking circuit. This example here is the Ann Arbor Times. It looks like a legitimate website. It is not. There is no such thing as the Ann Arbor Times, but somebody has been setting up these fake news websites, and then they can use them to share whatever articles they want and add sort of a sheen of credibility to the message they're trying to send, even though it's really completely fabricated, not by journalists. And there's no real easy way to control that. This is another example more related to the healthcare industry. This is a screenshot from the Plandemic documentary that was released near the beginning of the COVID-19 pandemic. And it was released by some filmmakers and a scientist that really just wanted to boost their own credibility. They wanted to make money doing speaking circuits. You know, there was a lot of debunking around this topic, right? So whether or not there was any valuable information in Plandemic or not, I'll leave that up to you to decide. But certainly the video itself was produced in a way that helped them to, it's helped them to get their own name out into the community and to get their name in the news. So who are fraud victims? A lot of people have a misconception that the elderly are the most likely to fall prey to scams, but that's just really not true. Of course, people who are doing Medicare scams aren't going to approach 18-year-olds, but on the whole, all age groups are susceptible to falling for scams. Older Americans tend to lose more money in scams, mostly because they have more money to lose. They have more resources than a 20-something would. But in general, all people of all ages can be a victim of a scam. And healthcare fraud causes tens of billions of dollars of losses each year, according to the FBI. So next slide, I'll pass it on to the next group. Oh, no, sorry, this is still me. So one more thing for you to keep in mind is when we are doing education at the public library level with adults, it's good to know what we are teaching people because you want to be able to help reinforce those messages, and it also affects how you may present yourself. And we'll talk more about that at the end of this presentation. So when I'm working with adults, we often talk about how if it seems too good to be true, it probably isn't true. If it seems too scary to be true, it probably isn't true. You don't want to be pressured to make a decision. All those high pressure situations where your utilities are going to be cut off right away, or the police are going to come, or something like that, where people are being forced to do a quick decision, that's a red flag that it is a scam. We train people to always return a call on a number that they look up. So don't just answer the phone and start giving out your personal information. If you answer the phone and the person on the other end says it's your bank, say, I'm going to hang up right now and I'm going to call my local branch and talk to them directly. And that can be a great way to head off a scam before it starts. But of course, that may affect you as a person who might be calling potential clients. So you need to think about how to deal with that. We also tell people to be very conscious of details. Watch out for things that just sound funny or look funny. Trust your instincts and always keep your guard up. So we'll talk at the end again about how you can help work within that framework when you're talking to consumers and you're providing legitimate services to them.
Okay,
So,
that brings us to our first poll question. True or false, the elderly are the #1 victim of fraud? Who was paying attention?
And we're about 20 seconds for that. We'll give it another 10 seconds or so, and then we'll close that out and share the results.
Okay, so we have 54% said true and 46% said false.
Sorry, guys, you weren't listening too well. All ages are susceptible to scams, and the elderly do not fall victim to scams at a higher rate. They do tend to lose more dollars because they have more dollars to lose typically, but all ages are susceptible to scams. So you need to be aware of this for all of the consumers that you're working with, not just your older patrons.
Yeah, and I'll just chime in a little bit on that front from DADCAP's perspective. You know, we spend a lot of time trying to educate younger people because they are more likely to share personal identifying information online. They're much more free with their information and their location and what they're doing and what they're eating. You name it. They want to share it with anybody who's paying attention. And all of that information can be aggregated to exploit people. So there's that, and they're also less sophisticated about often less sophisticated about how to avoid scams. So we often see scams around rental situations, first-time rentals, financial scams, get rich quick scams, all kinds of things like that. So Teresa's absolutely right. They don't lose as much money because they don't have it just yet, but they tend to be much more exploited and easier to exploit because they're so free with their information. And in fact, we get complaints all the time. And it's always interesting. It's usually from the older generation. And oftentimes they're just telling us about them because they're so well versed in what these scams look like. The other thing I'll say about this too, and we'll get into this in more detail, is that scammers are very sophisticated. They've gotten more and more and more sophisticated. And so, their entire systems of people, like corporate structures of scammers. They have the low level people who write the emails, and then they have their supervisors that review the emails to figure out what they look like. And then they have the people over that. There's a pyramid scheme of, and you work your way up. And so, years ago, we used to say, well, if it looks like there's typos and that kind of thing, it could be someone speaking in a different language and they don't know how to write an email. Well, that's sort of the scammers of the past. Now they have aggregated your data. They know where you're vacationing. They know your job. They know your real estate agent. They know all kinds of stuff, and they sprinkle in information that is true and accurate to lure you in and build your trust. And say, oh, so this must be a legitimate email. This must be a legitimate text. This must be a legitimate call, because they have this little piece of information that is totally accurate. And that is why what Teresa said about going to trusted sources of information, ignoring those unsolicited text and calls, and saying, you know what, this sounds interesting. I'm going to call my healthcare provider to see if in fact they are offering a gift card or whatever it is. But using that source of information that you trust, and not one that's popping up in your inbox, your social media, or your phone call.
I just fell for one last week. I clicked on it, but that was enough to now get me a deluge of text messages. It was a text message. It was right after I shopped at an organization that I have a rewards account with. And I clicked on it because it seemed like they knew exactly what I had purchased and what I did. And I thought it was legitimate. And now I'm inundated.
And they also, there's such a volume of scams being sent out that they can play on numbers. So if they send out 1 million text messages and only 1% of those people happen to have just shopped there, they're still making money on the scam. So
well,
a lot of times they hope for those kind of coincidences.
Yeah, well, it's pretty creepy because it seems like they know what my plans are for the weekend too. So
well, I'll just say one more thing about what you just said, Stephanie, and that is it's really important to share your experiences. And we really appreciate it when people do that, because, and there's, eliminate the shame. We get a lot of people who come up to us and tell us, I fell for this, my aunt fell for this, my grandma fell for this. The only way to really understand the way this works is to talk about it and to be honest about it, so people can identify them themselves. So I really appreciate you sharing that, because that's a really important part of the educational piece.
all right. So self-humiliation. Let's move on. Okay, so Christina's going to show us some actual scams and fraudulent sort of activity that was real in Wisconsin.
Yeah, so what kinds of things are we currently seeing, or what do we typically see? First of all, um, we've already sort of touched on it, but high pressure sales tactics, double talk, not answering your direct question with a direct answer, but looping around in another circle with what's in it for you. Um, Products have the appearance of ACA compliant insurance, but often are not. They're meant to lure people in. Um, we see products with very limited provider networks as to be nearly impossible for a person to use, although they thought they were buying something that would be very useful to them. Products with hidden or unnecessary expenses bundled in, um, often not disclosed or not properly disclosed. And I'll make a note, short-term limited duration plans. So, some of the things we're going to talk about are can be legal, legitimate products. However, those products often have limitations that make them not useful to people, either the very narrow provider networks or pre-existing condition exclusions, very limited coverage. And on occasion, bad actors will include unnecessary and unwanted benefits that appear to be included or free or things you're missing out on, but you're actually paying the cost of that in the form of what we call junk fees, and you don't know that until you start getting the bills, or you get strange cards in the mail for a discount program that you didn't realize you signed up for. Even if a policy is legitimate, it may not be what the consumer needs, and they're often tricked into enrolling in that type of plan. Other times, companies are not actually insurers, but can be healthcare sharing ministries that aren't regulated products, and in many cases aren't licensed to sell what they're offering. Um, so with that, let me jump into a couple. Thank you. A couple of examples of things that we've seen. You've probably seen these. Joe Namath, the William Shatner, J.J. Walker is another one. You see these ads on television. Companies using well-known individuals or celebrities to convey familiarity, again, giving them that sheen of legitimacy. Well, if William Shatner's involved, it really can't be misleading. Well, it really can be. Um, these television ads often urge seniors to call an on-screen toll-free number to find out if they qualify for extra benefits. They let them know that they're missing out on benefits that they're entitled to, and that they should act quickly. Um, and consumers are often surprised by the limited provider networks, and being forced to find new doctors, and having difficulty accessing services in general. So some enforcement actions by the Center for Medicare and Medicaid Services have resulted in improvements in this arena, but it's still a pretty significant problem. Thank you. Next slide. This is another tactic that we see quite a bit of. You might put in a, a basic search for health insurance, and you suddenly start getting fed lots of ads for Obamacare, or even Marketplace. They use Obamacare Market in this particular slide. Trump Care, Biden Care, those things that are definitely misleading. They're meant to give the impression that they're some kind of government affiliated or government approved program. So we see this quite often. The other thing that you'll notice at the bottom here are unauthorized use of logos of well-known companies. You see the ad and it's got really familiar, really legitimate companies there, but in many cases, these companies are they're not affiliated with the group that's using this tactic to generate leads for agents selling other other stuff. And these companies, they're not aware. Aetna is not aware. Blue Cross Blue Shield is not aware that someone has swiped their logo and placed it on this advertisement. Next slide. Thank you. Telephone solicitations. These are something that we see quite a bit. Again, the high pressure sales tactics. The agent will sometimes avoid providing direct responses to questions that give away the true nature of the product, steering responses back to perks or benefits. Sometimes telling the consumer that they can't release a copy of the policy or provide them with the actual terms until after they've made a payment, pressuring them into acting when they aren't ready to act. So misrepresenting the nature of the plans. We see again bundling or charging junk fees for unwanted products. And let's see, really difficult to cancel if, oh, typo, sorry. If the consumer does catch on, or when they catch on that this has been misrepresented, it isn't what they wanted, they call back to cancel. They're looped through a number of different hoops they have to jump through, and eventually they're funneled back to again this agent, the same trained kind of person who will talk them around any direct answers and apply that high pressure again to try and prevent or dissuade them from canceling. So they make it quite difficult. Next slide. Here's something that we also see repeatedly. These are mailers that might show up in your mailbox. This one was actually mailed to one of our staff. We get them quite often, but you see the repeated use of the word, the name Wisconsin. It says that it's a state regulated program, and threads our state name throughout to try and give the impression of legitimacy and familiarity. Oh, this is for Wisconsin residents. It must have been some kind of an approved product. So be watchful for those. And next slide. Social media, we are seeing a lot in social media. The platform is ripe with this kind of stuff. So this was a promoted advertisement, meaning that they're paid to pop up all over the place, and especially folks who are searching other areas for insurance. But in this example, you see there's a sense of urgency. This is new. It just passed. What else do we see? Yep, new, just passed. State of Wisconsin. They're referencing our state again to try and lend legitimacy. And we also see our state flag used and the image of our governor. Those are things that are not allowed at all. There's another use of the word Wisconsin there at the bottom that's cut off a little bit. But this is an actual social media ad that we saw in our feeds. So here's another mailer. This is these are postcards offering educational seminars. Consumers are often invited to attend free seminars about retirement planning or financial planning, Medicaid or Social Security. Come learn more about your Medicare benefits, that sort of thing. Often they're enticed with a free meal. We affectionately call these the chicken dinner offers. They might say that you come in and enjoy a meal while you hear about these planning techniques, and they sometimes will use rented space at community colleges and other places. You see this one was offered at Waukesha County Technical College. It gives it the air of having some additional legitimacy that, oh, the college is endorsing this or allowing this. Really, it's just space that they rent to the public. But they use this as a specific tactic. Sometimes these groups or these folks will even manage to get their planning session added to a list of courses that are being offered. So very clever. And almost always these are conducted by an agent for the purpose of selling insurance products. And the trickery is the key here. And let's see, other mailed solicitations. This one you see, I'm guessing you can find on your own several of those red flags that we covered in the prior slides. Medicare savings program, targeted to Wisconsin residents, no additional cost. I mean, there's all of that is threaded throughout this mailer. So thank you. And we know you want to know what you can do to help. How can assisters be part of the solution for people? One of the things that we want you to do is be aware of the tactics, be familiar with these things, help educate your consumers, the people you come into contact with. Show and tell them how to find and how to use those safe and reliable resources. Use healthcare.gov when you're referring to programs and plans. Reinforce that people should only use trusted resources and legitimate sites. A lot of the the .gov sites. Additionally, keeping in mind the other tips that we've heard, already. And you have opportunities every day when you interact with people to help protect consumers as you interact with them. And additionally, tell consumers to ask for credentials of anyone that they're going to discuss their insurance options with. Agents will carry business cards. They have their agent number, their national provider number printed on the card. Depending on how you're authorized through your organization, you'll either have a number and a business card you can provide, or you'll wear your name tag, bring your credentials, make sure that you show people your connection with and your affiliation with your organization, so they know that they can trust you and that you're not one of those one of the folks that are trying to lure them. And remind folks that they should never act when they feel pressured to do so. That's a really good time to end a call and walk away. And if you see something, say something. Don't wait for consumers to be victimized. Don't wait for someone to fall for the trick. If you see something that you think has some of these red flags, you should submit it to us. Not everyone is going to be a problem, but we are happy to look at them and make sure that we do try and catch the ones that are problematic. So you can submit those to us. We'll talk a little bit more about that. And Stephanie, we have another poll question.
So that brings us to poll question number 2. Which of these are red flags that an offer may be a scam? And go ahead and select any and all that apply. So the first one is high pressure sales tactics or limited time offers. Products marked as Obamacare, Trump Care, or Biden Care. Products marketed as new or just approved. I also like just improved. Marketing that infers that the consumer is missing out on hidden benefits, and marketing involving celebrities, or none of the above.
All right, why don't we give that another 20 seconds or so? We are only at about 75%. We'll try and get up to 80 here in just a second, but we'll close that out in about 15 seconds now.
I want to also acknowledge we're getting questions. A lot of them pertain to the next section, so we'll hold the questions for now. Okay, so the results are, and most of the audience, 80% or more, got all of it right. So they were all true. They were all red flags that an offer may be a scam, except for none of the above. So. Okay, moving on to our next slide. So, all right, we know these scams are out there. We know we may personally or consumers may fall for them. And what do we do when someone has fallen for one of those traps?
So I'll take this one and then follow you over to Christina. But what we should do is file a complaint, and anyone can file a complaint. The consumer can file a complaint, a navigator, an attorney, a neighbor, an agent. It doesn't have to be the victim. You know, certainly when you're investigating a complaint, if the victim is available, that's always optimal, but anyone can file a complaint and we encourage them to do so. In some instances, we can keep it anonymous. So that's also useful to a lot of people. We are subject to public records. So the complaints can be, you know, if we target, and so is OCI, obviously the state agency has to produce these things, but we can in many instances keep them anonymous. One of the things that we definitely want everybody to walk away with after this is that they can file the complaint either with DACAP or OCI, or both. We are in communication with each other. We understand we have dual jurisdiction. Oftentimes OCI has jurisdiction and we don't, or the vice versa, or we both have it. But we will make that assertion and then get it to the person who has the biggest bat to swing at the issue. So know that if you file with either of us, it will get to the right place. And we encourage you to do that. If you're exposed to a scam, we covered this a little bit, but document. The more information that you have, the easier it is for us to run it down. Certainly, a lot of these scams can be identity theft. So, you know, they can, we talked about at the beginning of this, there's misinformation and there's disinformation. So misinformation can lead you down the wrong path. And that, you know, oftentimes would be an OCI issue. You're in a program that is not necessarily a fraud altogether, but they've been deceptive about what they're giving you. It's not the right fit, you know, that kind of things. Sometimes it's a total scam and they have no intention of giving you anything. They just want to steal your money and your identifying information, in which case DACAP could be a little bit more useful in terms of working with your financial institutions, trying to shore up your identity and in some instances get your money back. But oftentimes it's really hard if people have paid in gift cards or wired money or cryptocurrency or things of that nature. That gets really complicated. So, which is why education is the key. I'll turn it over to Christina to talk more about their filing complaint with the OCI.
Yeah, thanks. Same thing, really, there's no wrong door. As long as you get to one of us, we will help, we'll coordinate with one another. You're welcome to start at OCI or start at DACAP, but we welcome the contact if you see something that you think isn't fair for consumers. I would also mention that many products have a free look period. This is, you know, often the first 30 days you can return a product for your money back and for a cancellation, an undo, if you would. And but those are short periods, and the sooner someone takes action, the better. So we don't want people to miss that opportunity if it exists. Getting in touch with us as quickly as possible would help identify if they have an opportunity to cancel or back out. So and also read anything that does show up in the mail or in the email. A lot of these are sent to emails and people miss them. If they've enrolled in something, it lands in a junk email box. So I guess people should keep an eye on what lands in their junk email too, as a way of knowing if they've accidentally or unintentionally been signed up for something or signed up for something that they need to review quickly. So, all right. For the Office of Commissioner of Insurance, we have an online complaint portal. We have several ways you can file a complaint, and all of them are actually explained on this webpage. There's a complaint link you can get to by putting it in that search bar that you see there, or on any of our landing pages. If you scroll way to the bottom of the page, you'll see a red box that says file a complaint, and there people have an option to file directly online, print a form and mail it to us, click a link to request a form and we'll send one out to them. So we make it pretty easy to get a complaint started with us. Next slide. And then a little bit about that process. We will investigate, and an examiner will reach out to the entity or entities involved. We will ask for information. We will try and remedy a situation when we can. Some investigations are quick and we get an answer back to people in weeks. Some of them take a long time because we're digging and investigating and perhaps having a hard time getting responses, or the complexity is greater. So there is some variance in how long things take, but we will take a close look at what we're provided with. And then the examiner will communicate the outcome of that complaint to the complainant or the source. So if you filed a complaint on behalf of a consumer, most times we would provide that response to you. We are often successful in getting consumers money back and getting them put back into the planner program that they were in if they were tricked out of it. So it is important to get in touch with us. And also important is that not only do we share within between the other state organizations or state agencies like DACAP, but we also de-identify data and share that on a national platform so that other regulators in other states know what we're seeing. And we do collaborate with other states to try and resolve some of these problems and get these programs shut down. Next. I wanted to touch on a couple examples. There are several in these slides, but I'm going to pick just a couple of them to highlight, and you can read the rest of them on your own later. Maybe skip to the next slide. This one is particularly concerning. The second bullet point there, you'll see that a consumer spoke to an agent, thought they were signing up for a comprehensive health care benefit, and they ended up with a healthcare sharing ministry product, which is not what they intended. And so they unintended consequence, they unknowingly purchased healthcare sharing ministry. In many cases, those ministry groups use collected contributions. They don't call them premiums because it is not supposed to be insurance, lest they be subject to our regulation. But they use these funds to spread claim risk across group members. But there's no insurer behind the coverage, and they can choose not to pay claims for a number of different reasons. And especially if they feel the services don't align with the group's faith-based values. There are a handful of legitimate healthcare sharing ministries that operate as promised and pay claims whenever they feel they can, according to their guidelines, but many more fail to provide the benefits that they've promised to people. I will say that the legitimate healthcare sharing ministries operating, they've started to reach out to regulators across the country to try and collaborate a little bit on how to get the bad acts to stop. So that's a positive in this. Next slide.
Christina, I'm sorry, could you just, because I noticed this in the questions, can
Sure.
you define if someone were to fall for that particular scam, would they be able to then hopefully get any money back? Would they be able to get a special enrollment period on the marketplace, or excuse me, healthcare.gov?
Potentially, yes. And the results vary a little bit. We have managed to get people's payments back. What's a little more challenging is if someone has a claim before they realize what kind of product it is, where maybe there was a pre-existing exclusion that they didn't realize, or the organization says it didn't meet their faith-based requirements, and suddenly you have a $17,000 emergency room claim, and the company's not going to pay it. Those are a little bit more challenging for us, but we certainly do try, and we have had some decent results. Not always.
And are they able to then get a special enrollment period to then purchase an actual ACA compliant plan?
In many cases, yes. I can't make guarantees, but we have had luck working with the marketplace, with healthcare.gov, to get those resolved for people. So,
Great.
Yeah. Let's see. I think I'm not sure which page. My pages are in a different order, but in one of these examples, we also have an agent who repeatedly asked for a customer's authorization to sign her up for coverage, which she repeatedly declined. It was obvious from us listening to the conversation that she had memory issues and did not intend to sign up for this product, but the agent pressured her until she agreed. We really don't like to see that. It does happen. If you learn of that, please let us know. File a complaint. Have the person file a complaint. And again, it's so important to avoid those high pressure tactics, so that people can feel empowered to hang up if that's happening. So,
Okay, great,
all
thank
right.
you.
Thank you.
Right, so I am going to talk about our complaint process, but I'll just dovetail a little bit on where Christina left off, to say DACAP gets all of these types of complaints as well, where folks are targeting vulnerable members of the community, and they really see an inroad, people who are isolated, people who may have memory issues, all kinds of things. Those are the saddest issues, and you often see them. We will see issues where people get sold non-insurance products and get confused about whether or not it's insurance, and it's like a discount medical card, and they, sadly will disenroll in their program. So definitely we see a lot of these. I saw some questions in the chat that I wanted to sort of respond to. One was early on about spam and scam text messages. There are ways in which you can, so in 2019, the federal government passed a new law that deals with robocalls and spam. And it went into effect in 2020. And one of the things that it does is require carriers to, screen these calls technologically better. And it also gave more money to regulators to investigate and bring enforcement actions. And so we have seen a little bit of a dip in these calls, and there have been some more enforcement actions. But on the carrier front, your carriers should be screening some of these calls and texts. So that's one thing you can talk to your carriers about how to do that. There's also there are also apps that you can put on your phone to prevent, to sort of cut down on spam texts and spam calls. And there are many of them that you can look in consumer reports. Nomo Robo is one, for example, that are effective. People who have Apple can limit the incoming calls to their contact list. And that would be true for text as well. So if you're, if you don't want to do that forever, if you start to get deluged with text or phone calls, you could do that for a period of time, and that will really curb them, and then you can turn it back off. But anyway, those are some tips about actually how to get rid of some of those calls. Someone else asked the question about the use of the term benefits in the one of the ads that Christina showed. Certainly, if there's deceptive advertising, we would pursue that. If there's a term of art that they're using improperly, that would be garden variety deception, and so we could pursue something of that nature. I don't know if Christina has any thoughts more specifically about their regulations, but deceptive and misrepresentations, that they may have an argument about why they could call it a benefit, but if we all know what a benefit is and they're using it in that way, we would say that's deceptive, and we pursue that. And then I think that's it. Oh, someone else asked about looking for legitimate companies. DACAP, you can call and find out if there's a complaint about the company at DACAP. My suspicion is you could do that as well at OCI. You certainly could look at the BBB, and then you can just do a really gross search online, get in your search engine and put the name of the company within scam or complaint or whatever, and see if there are complaints about. But legitimate companies are registered with DFI. You can find out if there have been complaints about them. So certainly if you're engaging in a company We are going to be, it's long-term, it's insurance, it's monthly payments, what have you. Absolutely do that research. Absolutely get online and figure out if there's any complaints against them and whether it's a decent company. So I would encourage that. Okay, I just want to cover some of those. But in terms of DACAP's complaint process, very similar to OCI's, we, as I said at the beginning, we have a hotline. We can take calls. People can answer questions. You can send in a written complaint, or you can go online and file a complaint at our department's website. We mediate those complaints. The first thing we do is we contact the company and say, this complaint has been filed against you. Tell us your side of the story. A lot of times it's a misunderstanding, it's a communication issue, or it's not a big enough issue to make a federal case out of it, as they say. So we try to resolve it there. And we have a lot of success getting restitution to consumers in that instance, really just trying to communicate between the businesses. As I say, if it is a flat out violation, fraud, or it's clear that there's a pattern of conduct that we should be concerned about, it's a postcard, but thousands or tens of thousands have gone out, we'll open an investigation and we'll see where. We'll be in touch with the postal inspector. We'll be in touch with the marketing company. We'll figure out how many went out, who responded to them, who authorized it, and we'll investigate. And if there's a violation, we'll pursue enforcement, as I say, either through the department or through referring to the Department of Justice, who will bring cases for us. That is really our process. Next slide, actually, I put in a slide here where you can see on our website where you can file a complaint. So this is a picture of our website, and you can see here where you can file a complaint. And then the next slide is all of yes, right there. And if you go to the next slide, this has our hotline again, or you can send an email and file a complaint there. And then certainly you can follow us on Facebook and Twitter about scams like this or any other types of scams that we and then there's our student loan hotline. That's a separate conference, but if you should take that down if you have student loans. That's a really good hotline number there too. So.
And then Laura, just a quick question on the Facebook and Twitter account. Do you post what current scams look like? What kind of content are you posting?
Well, we can't, it depends. Like if there's an alert. So one of the great things about people filing complaints is that if there is conduct happening in a certain community, we can post an alert so that community knows. So like anytime there's a government program, there are scams around it. If there's a change in Social Security, if there's an enrollment period, the student loan forgiveness, tons and tons and tons of scams. But sometimes they'll target a community or an area code or a zip code. And so we use our social media accounts to put alerts out saying, there's a new utility scam going on. And oftentimes sheriff's offices will call us and say, we're seeing a lot of this, or we'll get a call from a library or what have you. So yeah, that's the kind of thing we'll put on our social media, or alerts about things like that. And then, just other reminders. And next month, October is cybersecurity month. And so we'll have lots of information about how to shore up your data and that kind of thing.
Okay, great. And then I just wanted to answer a few of the questions that pertain to the last section before we move on. Let's see. There were a couple about healthcare sharing ministries that I think Christina is going to answer online. And I want to remind everyone, those are not insurance. And then Julia Garvey had a question I think is something all of us are very interested in hearing. Is a limited benefit plan a scam or just a consumer mistake? I see this a lot and did not know that we should complain or that there may be a remedy. It always happens that someone with serious health issues results in uncovered claims and huge bills. So I'm hoping Christina can probably take that one.
And I'm sorry, I was just looking at the healthcare sharing ministry question and I missed your last question. Can you restate it?
Oh, yeah. Is a limited benefit plan a scam or a consumer mistake? You know, is there any recourse there?
I would say it may not even be mistake. They serve a purpose. They're legal. They have they were intended really to fill short gaps. If someone has a short gap between employment or between employment and starting Medicare, but um, they aren't robust. They have pre-existing conditions, exclusions, and can be perilous if something then happens to you during that small window of time. Um, the rules changed, not long ago to allow them to be renewable, where before they weren't. So I just say tread with caution with those.
So if an enrollment assister is assisting someone and they have these huge bills that their limited duration plan won't cover and they still need health coverage, should they come to you if they felt like they were misled?
Anytime someone feels like they aren't getting what they were promised or what they expected, I would say file a complaint. If the answer is that they've gotten exactly what they paid for, it said there was a pre-existing exclusion and they've identified that this condition was there before the service, we can at least help explain why the answer is what it is. And sometimes we're successful at unraveling some of those problems. So, and we certainly want to know about them. So, yes. File a complaint.
Okay, and then here's another one. I'm not sure that I know what MEC acronym means. Hopefully you do. So I thought SEPs were like a special enrollment period could be you could get that if it was a cancellation of MEC. And since those limited benefit plans and health sharing ministries are not, how does that enable them for a special enrollment period?
It's tricky. It depends on where the person came from before that and how long ago and what their other circumstances are. They are tricky. So I would say contact us and let us take a look at it.
Okay. Is a limited benefit plan a scam when the seller does not acknowledge the plan's shortcomings, i.e. not informing the consumer that essential health benefits may not always be covered as they would be in a QHP?
Yeah, the plan itself may not be a scam. It may be just exactly what it purports to be. But we do have laws that expect disclosure of the nature of a plan and a product. And we have misrepresentation laws that include misrepresentation by omission. So I would say if in doubt, file a complaint with us so we can get to the bottom of it.
Okay. Okay, here's another question. How does an enrollment assister know when to guide a consumer with filing a complaint? Sometimes it's unclear if we should recommend filing a complaint with DACAP or OCI. Common complaints that assisters see are related to health insurance, a healthcare bill, or collections for an unpaid bill.
I would say if ever in doubt, go ahead and file. The worst that can happen is we redirect or we aren't able to resolve, but we would certainly rather take a look and see if there is something we can do. So and Lara, do you have any other thoughts on that? I would say err on the side of filing a complaint so we can investigate.
And I would say file it at OCI or DACAP. And like I said, we'll get it to the right place. Either of us we'll be in conversation about it. So but definitely file and definitely document and definitely give as much information as possible with the original filing, because the more information you give up front, the less time it takes.
I see one other question here. I work in a cancer care clinic. I have patients that have purchased these limited benefit plans. Oh dear. They were led to believe they were full coverage plans. Yeah, I would definitely recommend that you file. I'd also like to say that you know, reach out to a navigator. A navigator can help people file, make these appeals, and help them find coverage. So that's a situation where we want them to get the right kind of coverage and to pursue all avenues. Because especially if you have a debilitating health condition, you may not be up to the fight, right? And sometimes you just need someone to help you do that. Okay, I'm going to go ahead and move on with our 10 minutes so that we can talk about some really, really important strategies in our own work. And then we'll hopefully have time for the last questions. And if not, I would encourage Christina and Lara to go ahead and answer those online. Okay. Oh, excuse me. Poll question number 3. Where should you file a complaint? We have very limited time for this. So if you could just, it's not even popping up. We're going to skip this one. The answer is either, both, all of the above. Just file one if you think you should. Okay. All right. I believe this is Teresa's section.
Yeah, this is me again. So I've been fascinated to hear this conversation. I encourage you to reach out to those of you who are doing community outreach, reach out to your libraries, because you'd be surprised at the varied questions that we get as librarians about scams and about healthcare related issues. So please don't hesitate to reach out to us if you want to share information, if you want to work together on helping to educate the public. So all of this also has implications for you as legitimate providers. So because we're training people to be always vigilant, because we're telling them always keep your guard up, this can affect whether or not people believe that you are providing a legitimate service. So Stephanie asked me just to talk briefly about things that you can do to help convince consumers that what you're doing is legitimate and that you are there to help them, that you are not a scammer. The first thing is to be professional in all your communications. Use good grammar. Proofread carefully. Use language that's professional, but not unnecessarily convoluted or weird. So people are looking out right now. For some reason, the word kindly is appears in all kinds of scams, and you'll see that's unnecessarily stilted or formal language raises red flags for people all the time. I think Christina talked earlier about identifying yourself and the organization you work for. Wear a name tag, have business cards. Make sure you have legitimate ways for people to contact you. Use your organization's style sheet or branding guidelines. This is more important than you think. When you are putting out a poster, if the font that you're using doesn't match the poster that they saw last week, that's a red flag for people. They want things to be consistent. That helps to reinforce your message, but it also helps to reinforce that your organization is professional. It is putting out those consistent communications. And can be trusted in that way. So if your organization has poster templates or things like that, use them. Don't invent your own thing. Don't slap on some weird looking clip art to grab people's attention. It really does the opposite. It actually makes people think that maybe this one isn't legitimate because it doesn't look like the last ones that I saw. And then the biggest thing that I would emphasize is that piece of information that we give to consumers, which is always don't answer a cold call, verify information even that you're sent in the mail. And so if you are sharing, for example, a phone number that doesn't appear on your organization's website, that's a red flag. You need to make sure that what information you're sharing with consumers is also the same information that they could look up on their own to find you or to find your organization. And again, using those easy to remember accurate URLs like referring to healthcare.gov is really important, because a Google search for the healthcare marketplace will not necessarily turn up healthcare.gov depending on who's doing the searching. We all know that there are filter bubbles where people are going to be fed search results that match what they've clicked on in the past. And for some people, they're going to get all those legitimate resources, but for some people, they're going to be, misdirected through some of those search engine advertisements and some of that search engine gaming that goes on to find sites that are not legitimate. Next slide, please. want to try to go through this quickly because I know we're running short on time. I wanted to share this example. This is not healthcare related, but I think it's kind of a good example for you to think about. This is a legitimate letter from the state of New Jersey that went out to drivers for DoorDash. New Jersey is really cracking down on misclassification of workers, and they're doing an investigation of DoorDash and Uber and all these other things. And this was a legitimate letter that went out to DoorDash drivers. But if you look carefully at this letter, there's a misspelling in the first line of the letter. It says, "Dear Sir, Madam," instead of being personalized, which can happen for lots of reasons. But throughout the letter, there's serif font, and then there's sans serif font, and then there's serif font again. So the fonts are not consistent. And then the biggest red flag was that the date of the letter was August 23rd, but they wanted a response by May 24th. So clearly somebody didn't take the time to proofread this letter, even though it was legitimate and taxpayers were really required to respond to it. There was a lot of confusion online about whether or not this was something people should just throw in the trash. You don't want to have that happen because it's sometimes hard enough to get your message out to consumers. So when you are communicating, you don't want people to look at something and go, well, that looks suspicious. So be really careful when you're proofreading. It actually does matter. If I was brought this letter by one of my library patrons, I would have pointed out all those things and said, gosh, this doesn't seem legit. And again, what we're going to tell people is call the Department of Labor and Workforce Development and verify it. Next slide, please. So that brings up the point where you should be communicating with other relevant agencies. I know a lot of you are already doing that, but as Lara mentioned earlier, every time there's a new program, there are scams that surround it. So if you are doing something new, you want to make sure everybody knows that it's coming from you and that it's legitimate. So if you are, doing outreach to libraries, make sure people know in advance that you're doing outreach to libraries. That's really important so that everybody has a consistent answer to questions. And then another great way to reach people is through partnerships and outreach. People really believe things when they come from trusted members of their community. So libraries are great partners. We'd love to partner on things like this and share information for our patrons about services that are available to them. Senior centers, clinics, food pantries, schools. I'm sure you guys can think of lots of other partners that you can work with in your communities. But I can't emphasize enough how important it is to make those personal connections. Scams arrive in many other kinds of ways at much higher rates. It's not very likely that a person shows up at a public library who is a scammer, and consumers know that. So it's those partnerships and outreach can go a long way towards reaching the audience you're trying to reach. And I think that was the end of me.
Okay. So we have, it looks like 3 minutes to answer questions. I think Laura and Christina have likely been very busy with the questions. Is there anything in the questions that you answered, Laura or Christina, that you want to bring to the overall group that you think is important to know?
I wouldn't say anything specific from the questions necessarily, but I would reiterate, if ever in doubt, call us, file a complaint, either agency, and let us try and help.
Great. I'll just say I was really excited putting this presentation together because I didn't know as much about DATCAP and their role in the consumer complaint process. And something that I have learned along the way is that if you're going to do like a large mailing out in the community or lots of outreach cards out in the community, it's important to let DATCAP know because their consumer bureau will get phone calls asking if you're a legitimate business. So I don't know, Laura, if you want to say anything about that.
Yeah, great flag. It's absolutely true. The more we know, the better we can support you in the work that you're doing. And we love it when people call us and say, I'm getting these weird things. What are they? And if we know they're not weird, they're actually really useful and you should respond to them. That's a great flag. We get calls, as I say, from sheriff's departments, from community centers, from libraries, and trying to let us know about an issue that they're concerned about in their community. I think Teresa's presentation about how to represent yourself as a legitimate organization and a legitimate offer of help versus some of the scams was a good one. And I plan on co-opting some of that in our presentations because, it is hard when there are government programs out there for consumers to often distinguish between what is legitimate and what is not. So one other thing you can do is let us know and we can support you in that.
Great. Yeah, and
And-
I would say another takeaway for me has really been how important we all need to be communicating with our public libraries. The fact that Teresa didn't know who we were was very concerning to me. So let's all have that be a huge takeaway from today as well. In order to be legitimate, it's also important that legitimate organizations that are trusted in the community know who we are.
Yeah, and I love that message because it really is true. Libraries are on those front lines. People bring us questions all the time about every topic you can possibly imagine, including healthcare. And so I hope that Stephanie will share my contact information out. I'm happy to connect you with your local library system if you can't quite figure that out on your own, or at a more statewide level with that Wisconsin Association of Public Libraries. We would love to do any of that kind of work together. So these are important things to get out to the residents of our state.
All right, great. And with that, we will conclude. Thank you so much for the three of you for coming today and presenting. You bring such a wealth of information, and I think it's been extremely valuable. And I did see that in the question, there was a comment that it was an excellent presentation. So I thank you all for that.
Thanks for having us.
Thanks.
Thank you.
And thank you, Stephanie, so much for guiding this group and this presentation. And I'm just like looking at all the love emojis and clapping emojis flow, and it's so gratifying. I think this is really, really, really valuable information. I mean, we struggle with this. And boy, I learned something new also, just the value of outreach, community outreach, and partner relationships. Like that builds credibility. So I'm going to try to use that next time I'm talking about why we do outreach. So thank you. And before we leave today, the gift card winner for today is Sue Sorensen. So congratulations to you, Sue. And thank you again, everybody, for your participation. We'll be back on Monday. Have a wonderful weekend and enjoy the rest of your day. All right,
Bye.
take care.
Thank you.
Bye.